Communication mistake number 1, minimizing the patient's concern. Now, one of the fastest ways to escalate an upset patient and send them through the roof is to make them feel dismissed. And here's the important thing. It doesn't matter whether you think the issue is serious. What matters is whether the patient feels concerned. If it's a concern for them, it's a concern for you and your team. A patient might call and say, "My front tooth feels loose. My temporary feels uncomfortable. I'm worried something isn't right." And sometimes the response from the office becomes, "It's probably nothing serious." Or, "If you're not in pain or the site's not infected, it's not an emergency." Or, "We can see you in a few weeks." Now, clinically, that may sound reasonable to you and your team members, but emotionally, the patient hears, "You're overreacting. Your concern isn't important. You're on your own." And that's when emotions escalate. Great teams understand something critical. If the patient believes it's urgent, then the conversation should reflect and match that urgency. That doesn't mean panic, and it doesn't mean that every patient gets seen immediately, but it means acknowledging the emotional reality of the person in front of you. A much better response sounds like this: "I can hear that this is really concerning you, and I want to see how we can help." That single sentence changes everything. The patient now feels heard, validated, supported. And the goal of communication is not simply to deliver information. The goal is to create trust, because patients don't escalate when they feel understood. They escalate when they feel dismissed.